Hello and welcome. Today we're diving deep into a complex and important topic, transitional cell carcinoma, often referred to as TCC. This is a type of cancer that originates in the lining of the urinary system, and understanding it is key for early detection and effective management. So, what causes TCC? Unfortunately, the exact cause isn't always clear, but we know several factors significantly increase the risk. Smoking is by far the leading culprit, with smokers facing a much higher chance of developing the disease. Exposure to certain industrial chemicals, particularly those used in the dye, rubber, and leather industries, is also a known risk factor. Chronic bladder irritation, such as from long-term urinary catheters or bladder stones, can also contribute, and in some cases, genetics may play a role, although this is less common. Let's talk about how TCC develops. The urinary tract, including the bladder, ureters, and urethra, is lined with transitional cells. These cells have the unique ability to stretch and contract, accommodating changes in urine volume. When these cells undergo uncontrolled growth and division, they can form tumors. These tumors can be non-invasive, meaning they stay within the lining of the urinary tract, or invasive, meaning they spread into the deeper layers of the bladder wall, or even to other parts of the body. The cancer starts with genetic mutations that cause these cells to grow abnormally. As these cells multiply, they form a mass, which can then spread through the bladder wall or to other organs. TCC is a relatively common cancer, especially in older adults. It's more prevalent in men than in women, and the risk increases with age. The incidence varies depending on geographical location and exposure to risk factors like smoking and industrial chemicals. In the United States, bladder cancer, which is often TCC, is among the most common cancers. Understanding the epidemiology helps us identify at-risk populations and implement preventative measures. The signs and symptoms of TCC can vary, but the most common is blood in the urine, also known as hematuria. This can be visible blood, making the urine appear pink, red, or even cola-colored, or it can be microscopic and only detected during a urine test. Other symptoms may include frequent urination, painful urination, a feeling of urgency to urinate, and lower back pain. It's important to note that these symptoms can also be caused by other conditions, but if you experience any of them, it's crucial to see a doctor to rule out TCC. Diagnosing TCC typically involves a combination of tests. A urine test can detect blood and abnormal cells. A cystoscopy, where a thin tube with a camera is inserted into the bladder, allows the doctor to visualize the bladder lining. If any suspicious areas are seen, a biopsy is usually performed. During a biopsy, a small tissue sample is taken and examined under a microscope to confirm the presence of cancer cells. Imaging tests like CT scans or MRIs can help determine the extent of the cancer and whether it has spread to other areas. TCC is often classified based on how far it has spread, which is called staging, and how abnormal the cancer cells look under a microscope, which is called grading. Staging ranges from stage 0, where the cancer is only in the lining of the bladder, to stage 4, where it has spread to distant parts of the body. Grading ranges from low grade, where the cells look more like normal cells and grow slowly, to high grade, where the cells look very abnormal and grow quickly. Different types of TCC exist, including papillary and flat tumors. Papillary tumors grow into the bladder like tiny fingers, while flat tumors stay within the lining of the bladder. Treatment for TCC depends on the stage, grade, and location of the cancer, as well as the patient's overall health. Treatment options may include surgery to remove the tumor, chemotherapy to kill cancer cells, radiation therapy to target the cancer with high-energy beams, and immunotherapy to boost the body's immune system to fight the cancer. For early-stage TCC, a procedure called transurethral resection of bladder tumor, or TURT, may be used to remove the tumor. In more advanced cases, the entire bladder may need to be removed, a procedure called a cystectomy. After surgery, chemotherapy or immunotherapy may be used to prevent the cancer from returning. While there's no guaranteed way to prevent TCC, there are several steps you can take to reduce your risk. The most important is to quit smoking. If you work with industrial chemicals, follow safety guidelines and wear appropriate protective gear. Staying hydrated by drinking plenty of water can help flush out potentially harmful substances from the bladder. And finally, talk to your doctor about your risk factors and whether you should undergo regular screening. The prognosis for TCC varies depending on the stage and grade of the cancer, as well as the treatment received. Early-stage TCC that is treated effectively has a good prognosis. However, more advanced TCC can be challenging to treat. Recent research has focused on developing new and more effective treatments for TCC, including targeted therapies that specifically target cancer cells and immunotherapies that harness the power of the immune system. Scientists are also working on developing better ways to detect TCC early, such as through urine-based biomarkers. These advances offer hope for improving the outcomes for patients with TCC. Thank you for joining us today. We hope this information has been helpful.